Hey ladies, today we're going to talk about pelvic floor dysfunction. It's very common after you have a baby or go through pregnancy that our muscles aren't working or functioning the way that they should. As we said earlier, the muscles should support our organs. They should hold back urine when we want to hold back gas in urine. They should evacuate that fluid when we want it to be evacuated. It should work with our diaphragm as we breathe and circulate the fluid through our system. And then it should also aid in sexual function. But after childbirth, those muscles take a true beating and it's very traumatic on them, whether you have a vaginal birth or a C-section. And whether even if you had an episiotomy, vacuum, whatever it is, whatever your story and journey is, those muscles take a beating. So a lot of stress happens during pregnancy with the growing uterus and baby, and that can even cause a dysfunction. So if you had a cesarean birth and you think that yours aren't involved, your pelvic floor is perfect, it is not, my friend. Then with our vaginal births and C-section postpartum, the scar tissue, if we've torn, can actually hinder the mobility down there. So lots of pelvic floors that have come into the clinic that we've seen, even if they haven't torn or had any scar tissue whatsoever, those muscles aren't functioning properly, probably due to the traumatic birth itself. Those muscles should move through a range of motion of relaxing and contracting. When they're not functioning that way, they can cause issues like peeing your pants, leaking urine, what we call incontinence. Urinary incontinence or fecal incontinence, both are very common after childbirth. If you are experiencing them, know that you can improve it, especially if you're just dribbling a little bit with coughing or sneezing, or having it during exercise with running and jumping. All of them can be improved. With you may have trouble with holding back gas or losing gas when you're walking down the hallway or picking up your kid, and know that that can be improved as well. Pelvic organ prolapse is another issue that can arise with these muscles. When the muscles aren't strong enough to hold the organs in place, or if we've been straining and bearing down with childbirth or having bowel movements, that can lengthen the tissue, and then the muscles are not holding the bladder where it should be, or the rectum where it should be, or the uterus. And then we start to feel that tissue in the vaginal canal, and it can feel like pressure in the vagina, like a used tampon or just added pressure in there. It's really uncomfortable, but that can also be improved if it's not too stretched out. And then pain with intercourse may pop up after having a baby too, and that's not fun. You know, if it feels like sharp knives being jabbed in you when you're trying to be intimate with your partner, that's not a fun atmosphere. And know that that can happen due to lack of mobility in the muscle tissue. It can happen because scar tissue is not moving well, or lack of blood flow, and then maybe the nervous system's just hypersensitive. We can help to improve that. So with the exercises, the stretches, the diaphragmatic breathing, and any of the strengthening and stability stuff in the program, we can help improve those symptoms. If things are still bugging you, it's okay to look out and find a pelvic floor physical therapist in your area to have help in person. And you can always shoot us an email.